Hello friends, your FMGE exam is getting closer. Most of the students are feeling anxious and stressed right now. Some of the students are worried about their incomplete syllabus. Some of the students are worried about how they will be able to complete all the 19 subjects before these 38 days of the exam. And some of the students are worried about how they will be able to recall the previously studied material or the topics. In this video, I will tell you the smart strategy for FMG June 28 exam which is upcoming, and I will also tell you the subject wise planning, what are the key revision resources, daily timetable, how to plan for effective covering of all the 19 subjects within available time. So I will tell you step by step guide to pass on your first attempt. If you are coming to my channel for the first time, then subscribe my channel. So for last 30 days, the priority schedule include rapid revision. Now you are already doing rapid revision. Now your goal should be maximum recall of previously asked topic in the exam and identify your weak area without any stress. So what are your key revision resources? Previous year questions. So you have to study last 5 years of PYQ. 20 to 30% of these questions are direct repeat and 30 to 40% conceptually similar or twist type of the questions are asked in FMG exam. So let me clear the confusion of most of the students. They think that the PYQ are the direct repeat for most of the time in the exam, but this may be partially true. Only 20 to 30% are direct repeat, 30 to 40% are conceptually similar or they are from the similar topic, and these are repeated years after year in every exam. Now clinical vignettes are the scenario with the history and examination results before asking you particular question. So you have to practice this type of the case scenario where you are provided with the patient history, symptoms, examination, diagnosis, lab parameters, and from that you have to judge what are the interventions or what type of the management you will choose for this patient. So this type of the lengthy multi-clause clinical vignettes you have to practice every week. Train your brain to handle this type of the long form analytical scenario systematically rather than just memorizing the answer. So these things are very important when you are revising for the final time for your FMG exam. Apart from this, high yield mnemonic, you all must be studied some type of the mnemonic to prevent silly mistakes on recall heavy topics. So this you have to revise during these last 30 days. High yield topic or previously asked question related areas or which we call as a PYT. Also you have to revise in this 30 days of time. Volatile information which includes scores, staging, tables, immunization schedule, antidote for poisoning or drug of choice. This type of the volatile information also you have to revise. Apart from this, you also have to make active MCQ routine. If you are just passively watching the video, then it is a serious mistake. After completing particular topic, immediately solve at least 25 to 30 PYQ type of the MCQ. Same topic you have to do on the very same day so that you can check your immediate retention, and that will help you to prevent exam day burnout. Every day you have to make a habit of solving 150 to 200 MCQs to check your immediate retention whatever subject you are learning. One grand test every 2 weeks you have to plan. You have to identify what are your wrong answers and immediately you focus on your weak areas. Now coming to the subject wise weightage. So according to the last 5 years, in category 1, the major high yield subjects are medicine, gynae, surgery and PSM. These 4 subjects alone carry massive weight up to 100 plus marks. Now this doesn't mean that you skip the other subjects. You also have to give equal weightage to the category 2, which are your medium core: pathology, pharmacology, microbiology, pediatrics, ophthalmology, ENT, biochemistry, anatomy and physiology. These are your medium core subjects. You have to revise these subjects also. Category 3 are the short subjects which are your score boosters, and these include psychiatry, anesthesia, orthopedics, dermatology, FM and radiology. Don't skip these, as these subjects you can cover very easily within 2 to 3 days. The questions which are asked from these subjects are usually easy and this gives you guaranteed marks. So suppose by solving the MCQs from these major high yield and medium core subjects, your score is 145, and if you are able to score at least 5 marks from this short subject, then you are able to just pass in your FMGE exam. So don't skip this short subject considering as a low weighted subjects. For rapid revision in the last 30 days, you have to adopt sandwich formula. Now let us discuss what is sandwich formula. In sandwich formula, you will first revise the major high yield subject which will give you at least 20 to 30 marks with the two medium core subjects which carry about 10 to 15 marks. And along with this, you can sandwich at least one short subject that will be your score booster, that is approximately 5 to 7 marks. Now the reason for combining the major subjects with the two medium core and one short subject is that when you combine the short subject, then it will give your brain a strategic short break, and this type of approach will maintain psychological momentum and fast track completion of all the 19 subjects within the time. Along with this, you have to do strategic integration. Here you can integrate the overlapping subjects. For example, you can integrate medicine with the pharmacology and pharmacology with the anesthesia to save the revision hours. Already you are having only 30 days to complete whole syllabus, and this type of the approach will save your time for rapid revision. For strategic approach, you will do digital copy trick. On every page of your note, you locate the exact 20% of highly volatile things. For example, drug interactions, cancer drug toxicities, or clinical staging tables. These are the volatile information. So you don't have to write each and every volatile information in your notebook. You just take screenshot of this complex volatile information and save in a dedicated single folder for daily review. Now you look at these images for 10 minutes every night before the bed, so that will help you to memorize these things faster. This digital copy in a single folder will also serve as a gold mine during the final week of high intensity rapid revision. Now if we assess the question trend in FMGE exam, then they generally focus on clinical case scenario type of the question, image based questions, and they focus only on the single correct answer. So this type of practice you have to do every day. To simplify the time schedule, I have divided all the 19 subjects into phase 1, 2 and 3. So let us first discuss about the phase 1. In phase 1, you start with the gynecology, allot 3 days using revision notes, pair this with the pediatrics for 2 days because neonatology and developmental milestones overlap heavily with the gynec. Then you can sandwich short subject like dermatology for 1 day. After that, you can start with the internal medicine, give it 4 days of a pure uninterrupted focus, pair it with the ENT, that is your short subject. After that, you take 3-day block of pharmacology because you have just studied clinical medicine, learning systemic pharmacology mechanism and drug choices become twice as fast and logical. Now pharmacology you can pair with the anesthesia and forensic medicine, as these subjects are also having some of the overlapping topic with the pharmacology and also some with the medicine. Finish this block by dedicating 1 day for ophthalmology and radiology so you can master the imaging basics for radiology, and this will also provide a short break to your brain, which is highly desirable after completing these major subjects. Now coming to the phase 2 subjects. For surgery, you have to dedicate 4 days, focus heavily on clinical presentations, diagnostic investigations of choice and high yield instruments. Pair surgery with the orthopedics. Then you can start with the pathology and you can give 2 days for pathology, general pathology and neoplasia. These are the core topic for pathology. Remember, image-based questions are generally asked from pathology, so don't forget to take screenshots of high-yield pathology slides and systemic gross image and put all these images into single folder for your final week revision. You can allocate 2 days for microbiology because this requires pure memorization, and biochemistry again for 2 days. In phase 1, if some of the topics for anesthesia are left to revise, then that you can pair here with the psychiatry and complete your anesthesia also. So this complete your phase 2. Now in the phase 3, anatomy and physiology, you will give 3 days. For PSM, you will give at least 1 day. Now why PSM I have kept at the end? Because this subject is also one of the volatile subject. You have to study health programs, biostatistics, which include different types of the formulas and epidemiology. This if you study too early, then you are likely to forget all the data. So that is the reason you have to revise PSM at the end. After completing all these 19 subjects, you will still have 2 days and use this time for sharp and fast paced revision. Most of the students complain that whatever they have studied previously, they tend to forget as the time passes. So that I can explain with the help of this theory, and the name of that theory is the memory escalation theory. So let us understand what is this memory escalation theory. So during your first revision pass, you will only remember 35 to 45% of the content. The remaining 55% will feel completely new, and that is totally normal. During the second revision pass, retention naturally climbs to 55 to 60%. In the third revision pass, memory saturation kicks in and you hit 70 to 80% of the retention. So this is where visual memory takes over and you can literally visualize which corner of the page an answer is written on. So you will pass on from all these stages. So stay confident and trust your preparation. Now coming to the daily timetable. Now in the morning session, always start with the 10 to 15 minutes of meditation. That will help to calm your brain and also helps your brain for better retention. 6:30 to 9:30, you can choose most difficult topic which requires high concentration and use short notes or annotate PDFs only. Do not try to read from long textbook or deep reading of specific subject. In the mid session from 9:30 to 1 p.m., you can solve PYQs plus MCQ. Now remember, every day you have to solve 150 to 250 MCQ, and quality matters more than quantity. Now if you are able to solve at least 150 MCQ, then that is also absolutely okay, because here you have to focus more on the quality rather than quantity. When you are solving the MCQ, try to be in active mode and try to stimulate your brain for why this answer is correct or why this option is wrong. So that way you can practice your brain for final performance in the exam. In the afternoon from 2 to 7 p.m., remaining revision plus image based question you can revise. In the night, you have to do rapid revision of same day topic, as well as whatever MCQ you have answered wrong, that also you have to revise at the same time. One liners, table, formula, mistakes, all these also you have to revise in the night. In the daily timetable, whenever you feel tired or when your brain is not responding much, you can take 10 to 15 minutes of break. Now this is the most important part, and that is 30 days of priority schedule. So for 21 to 23, you will revise gynec, 24 and 25 pedia, 26 dermatology, and always remember in the night you will do rapid revision, plus you will have 2 hours after 10 pm that I have kept empty. So this schedule I have made from 7 to 10 pm. Suppose you are sleeping at 12, then extra 2 hours you are having here, and in this time whatever topic is left you can again revise them. From 27 to 30, you will study medicine, and along with that you will also study ENT. On 31st, you will start with the pharmac. You will complete pharmacology by 2nd June. Along with pharmacology, you will also study forensic medicine and anesthesia in the afternoon session. Ophthal and radio, which are your short subject, that you will study on 3rd of June. Surgery you will be able to complete from 4th to 6th June, and along with the surgery you will also complete orthopedics. Remember, the night session will be always for rapid revision. On 7th and 8th, you can study pathology. 9th and 10th, you will study microbiology. 11th and 12th, biochemistry. And on 13th, psychiatry. From 14th June, you will study anatomy and you will be able to complete by 15th June. 16th and 17th, you will study physiology. 18th, you will study PSM. So by the end of 18th June, you will be able to complete all the 19 subjects within the stipulated time. On 19, try to have a mock test for yourself for paper 1 in the morning and for paper 2 in the afternoon. Immediately after completing this test, try to correct your mistakes, whatever you have made in this mock test, and also identify the weak area and try to improve them. On 20, you will do high yield topic revision, image revision, and your weak areas consolidation. So this way, you can complete all the 19 subjects in a 30 days, and still you will be having 19th and 20 for revision as well as mock test, and still you are having 21 to 27 that will be your high intensity rapid revision. Now coming to the strategic advice, if your current revision notes are too bulky to finish within these 30 days, then switch over to more concise source. Every day study minimum 12 to 14 hours with your active efforts. Don't ignore images. 30 to 40 questions will be image based, and spend at least 1 hour daily for image question bank. Drug adverse effects, peripheral blood smears, histopathology slides, X-ray, CT scan, ECG, fundoscopy images, and dermatological photographs. This type of the image-based questions can be asked in the FMGE exam. While reading, try to focus on active recall rather than passive reading. Cover the page and try to recall the table contents or the mnemonic. Just like I have already uploaded the new drug update part 1 to 6 videos which are for INI-CET exam, that are also one of the important topic for FMGE exam. So watch this video about the new drug updates, and the link for each video is in the description box. Practice alertness. Do your heaviest revision during the actual exam hours to train your brain to be at a peak alertness during that window period of time. Take at least one realistic mock test to build endurance, fix pacing, and address exam time anxiety. So this way you can build your confidence very high. Now coming to the common mistakes to avoid. Most of the students commit this type of the mistake, and that is the reason they fail in the FMG exam. Starting new coaching notes or changing the resource frequently. This type of the mistake you should not do. So this time is only for the revision, so do not try to watch too many new videos. Most of the students commit this type of the mistake, and that is to read without any type of the revision. So you have to focus entirely on consolidating what you already know and fix your volatile memory. Another mistake is revising entire marrow or prep ladder again. This type of the mistake you should not commit. Most of the students keep the short subjects and they think that they have covered the major subjects and the medium core subjects, so they will be easily able to pass. But this is again misconception, as these short subjects are easy to score. You should not skip short subjects. Now sometimes due to some illness or due to any other reason, you are not able to follow the schedule and there is a temporary break in the schedule. In this type of the scenario, some of the students discontinue the schedule completely. This type of the mistake also you should not commit, and you should try to follow all the schedule till the day of the exam. Another common mistake is ignoring the PYQ and PYT. Some of the students ignore the weak areas and low weighted subjects completely. This type of the mistake also you should not commit. 7 hours of daily sleep is essential for your better retention as well as for better performance in your exam. So do not compromise on your sleep cycle. Eat healthy food, home cooked food, that will help to maintain your health, and do not compare with the others. Study smart, stay consistent, and follow the schedule till the exam. At the same time, also trust your preparation. So if you will be able to follow this schedule with the accuracy, calm mind, and smart strategy, then you will be able to pass in your FMG exam. If you found this video helpful, then don't forget to subscribe my channel. Thank you for watching.